A Silicon Valley company created a device that's showing promise for patients who've undergone breast reconstruction surgery. This high-tech device can also be used for other delicate procedures as well. To explain what this device is, how it works, is the president and CEO of Vioptics, Dr. Mohamed Elmandjra. Thanks so much for joining us today.
Thank you, Chris.
I know it's really early to wear a suit on a Saturday morning. You should have come in your sweats.
That's fine.
So tell us what's so groundbreaking about this technology?
Well, this technology that we call ODIS, optical diffusion imaging and spectroscopy, really allows surgeons to have information about the health of the tissues before any complication can develop.
Now, this is sort of in some women who have been having breast reconstruction surgery. They've been using their own tissue where it's been taken from another area of their body, right? And then used as a breast.
Exactly right. It's called a flap surgery or microsurgery in general, and this is one of the applications. So in this type of surgery, a woman typically after a mastectomy or breast removal has a breast reconstructed from her own tissue. The advantages of that is that obviously the patient has the peace of mind that their own tissue is being used, and therefore there is a better acceptance.
And the idea before was that there was no way to tell if that tissue was thriving and healthy except to maybe poke at it and make it bleed and say, oh, okay, it's still alive. So this takes the pain out of that. How does it work then?
Precisely. What it does is essentially it's an optical technology which shines light onto the tissue and collects light back. Blood has this characteristic that it changes its optical properties or its color depending on how much oxygen is attached to that blood. That's precisely why when you put a rubber band around your finger, it turns blue. Because you've just stopped the inflow of oxygen and its color changes. So what we do is we really detect the oxygen just using a light that is like a laser, shines in and collects light back.
Okay, now you can't show us exactly how the device works, but you do have some data here from one of your patients. Explain what that is then.
Yes, so this is a typical use. Actually, this is an actual patient data where this device has helped avoid a complication, essentially. So as you see here, during the surgery, the oxygen is measured and it looks pretty high. This is pretty normal. And then the doctors started seeing that the oxygen started going down. What happens after is that they've done something. Essentially, they unclogged the pipe and the oxygen went back up. After that, they monitored the patient for a long time and saw that despite that, the oxygen kept going down. It reached a limit, and then they really did another operation and went back to normal. So fundamentally what you do is you're seeing that the tissue is suffocating before the tissue dies.
Before there's any complication. Now we always like to know what the additional applications are. We recently saw a woman in France have a face transplant. Could this be applied to that sort of situation? We haven't had one of those here in the U.S., but we know that somebody's probably going to do it soon.
Absolutely. As a matter of fact, the two major centers in the U.S., and unfortunately I can't disclose their name, but the two major clinical centers in the U.S. that are considering a face transplant are working with us and are using our technology. So this would be absolutely the perfect way to monitor.
And just a better way to know whether things are healthy without going through more painful procedures.
Exactly. Right? It's something that allows you to see something much earlier on and avoid some very painful and very costly potential complications.
Proving once again, Silicon Valley, the Bay Area is at the front edge of technology.
Absolutely.
Thanks so much for coming in and joining us. And
we're
glad to know that folks are going to be able to find out a little less painfully whether they're doing okay.
Thanks for having me.
Thank you. Coming up next, a figure skater Michelle Kwan's quest for gold medal takes an important step forward, and a new threat